What is a recoupment? When an insurance company audits past payments to a provider and they make the determination that that was an error in the processing of a medical claim resulting in what they view to be an overpayment, it's usually brought as a refund request and may be linked to a special investigation. Okay, so you have to think about recoupments as denials. They're retroactive denials. The insurance company is saying, I paid this claim, and now it could be 4 years later, and we realized that we made a mistake. That claim was not medically necessary, or there was no coverage in force, or we paid at a usual, reasonable, and customary rate, and we should have paid at 110% of Medicare. It's a retroactive denial. So what does that tell you? If you get a denial of a claim, or for out-of-network, if you get an underpayment, you have the right as the assignee of the patient, if you're a medical provider, to file an appeal, a formal appeal. And it's required that the insurance companies and the various health plans afford at least one, and in most cases, 2 levels of appeal. So that being said, if you get a refund request or an audit, you have the right to appeal. It is a retroactive denial. It's very important to understand that. Okay, let's talk about a couple different types of refunds. And my position is you need to formally appeal in writing every refund you get. So the first type is off of an EOB. Sometimes you'll get an EOB or a provider remittance form, and it'll say that the claim is allowed at, let's say, $1,000, and it's set to pay $800, but it says 0 for payment. That's not only is that a refund request, it's an offset. It's what we call in the business a cross-plan offset. This happens very much. When you see a negative value on an EOB, you have to assume it's a cross-plan offset, which means you have to call the insurance company and find out why they're cross-plan offsetting. They're not supposed to be able to do this. Again, it's a retroactive denial. You have a right to appeal. They shouldn't be offsetting on an unrelated claim without giving you a right to an appeal, even if you're in network. Okay, so that's one type of refund. The most common type of refund is a letter that you get from an insurance company or one of their collection agencies indicating that there's a balance that's owed. They're giving you an opportunity to appeal in those cases. So I'm looking at one right now. It's a Cigna one, and they use a company called Accent Cost Containment Solutions. They're the recovery arm of Cigna. And in it, it simply says that we respectfully request your remittance in full, payable to either Accent or the above-mentioned client. Please send the refund or contact our office within 30 days. Now, this if you're looking at a further reason, most of these don't even give you what the reason is for the offset. In this case, I'm looking, it just says they identified an overpayment. They didn't even give a reason. Now, is an insurance company allowed to deny a claim without giving a reason as to why they're denying it? No. Under insurance law and under federal law, ERISA, which governs almost all the plans out there, it's an employer-sponsored plan, and it's self-funded, not an insurance policy, then it's governed by federal law, ERISA. All right? So this type of refund is inadequate because they're not providing a reason. You must appeal this in writing. Absolutely appeal it in writing. Now, you may want to pull the EOB. You may want to do a little bit of investigation. You may want to call them. Not a bad idea to call them and find out why they're doing what they're doing. All right? You have to make it very clear you're going to appeal, and you need to appeal to Cigna Accent. All right? And sometimes the insurance companies do audits, and they may request 10 or 15 charts. That's a bigger type of refund. That's setting you up for a refund. You provide the medical records, and then lo and behold, a month later or 2 months later, they say, all right, we've identified these claims, we reviewed them, and we found that there's significant problems with the claims. There's 5 claims that were denied inclusive, that should have been denied inclusive but paid. And then there are 5 claims that were not medically necessary and they shouldn't have been paid. And then what they do is something called an extrapolation. They say, well, you know, you owe us based on the claims we reviewed, maybe $5,300. But what we did is we went back in time 3 or 4 years and we did what's called an extrapolation formula. And in that formula, we've determined that we paid you for the inclusive code, you know, 1,300 times over 4 years. And we found that, you know, when we reviewed the claim, that of the 15 claims we reviewed, 5 of them were properly deniable as inclusive. So we're going to take 33% of all those payments we gave you, and that's what you owe us. So you don't owe us, you know, $5,000. You owe us $1.3 million. That's what they do. So those are the 3 types of recoupments. Obviously, the last one I discussed is the one that's obviously most important.